Have you ever felt tired in a way that didn't quite make sense? The kind of fatigue that shows up even after a peaceful night of sleep, or after a morning routine that should feel easy. A patient of mine once told me, "I thought I was just worn out, but something about that tiredness felt different." And I want you to imagine this for a moment. You're sitting at your kitchen table, the sunlight coming in through the blinds, a cup of warm tea in your hands, and suddenly your body feels heavier than it should. Your mind feels slower, almost foggy. It feels like fatigue, but not the kind you're used to. Moments like these are more important than most people realize. In fact, they're often the first whisper of something deeper. As a doctor caring for older adults for more than 30 years, I've seen how easily stroke symptoms disguise themselves as everyday tiredness. Many seniors brush them aside, thinking it's just aging, the weather, or a poor night's sleep. But sometimes the brain is trying to signal distress long before a major stroke ever happens. Fatigue is one of the most overlooked neurological warning signs. When the brain experiences reduced blood flow, tiny clots beginning to form, or sudden changes in pressure, the first symptom may not be pain or dramatic weakness. It may simply be exhaustion that feels unusual. I once cared for a woman who felt an odd heaviness in her body for 2 days. She kept telling her family, "I'm just tired." But that fatigue was actually the beginning of a mini stroke. That is why this video matters. Today, we will uncover how fatigue can reveal early stroke symptoms, the hidden signs most seniors miss, the patterns you should never ignore, and the simple steps that can protect your brain and preserve your independence. Before we go further, if this message is already helping you understand your health better, please subscribe, click like, and share Senior Health Daily. Your support allows us to continue bringing life-saving knowledge to our community. In the next part, we will begin exploring why these silent symptoms appear long before a stroke takes place. Why stroke symptoms can hide behind fatigue. I want you to imagine something simple. You wake up, make your breakfast, sit in your favorite chair, and suddenly you feel a wave of tiredness wash over you. Not the usual morning fatigue, but a heaviness, a strange weight in your arms or your face, the kind of exhaustion that seems to come out of nowhere. Most people brush it off. They tell themselves it's age or poor sleep or yesterday's errands catching up. But in my 30 years of caring for older adults, I have learned that sudden or unusual fatigue is often the brain's first quiet plea for attention. Fatigue is one of the most underestimated neurological symptoms. When the brain is under distress, it doesn't always send dramatic signals right away. Sometimes the earliest warning sign is simply a drop in energy, a fog settling over your thoughts, a feeling that your legs don't want to cooperate, or a strange heaviness on one side of your face that disappears before you even have time to question it. These moments matter more than most people realize. The science behind this is surprisingly simple. Your brain relies on a continuous, stable supply of oxygen-rich blood. When something disrupts that flow, even slightly, the brain slows down. It begins to conserve energy. It becomes sluggish. This slowdown can feel exactly like normal fatigue. But beneath that tiredness, something more serious may be building. A small clot may be forming. Blood pressure may be spiking. The vessels feeding a part of the brain may be narrowing. The brain, unable to speak in words, speaks through exhaustion. One of my patients, a gentleman in his 70s, came to see me after 3 days of what he described as odd fatigue. He said he felt tired in a way that didn't match his activity. He sat down to read the morning paper and couldn't focus on a single sentence. He felt his right arm lag slightly whenever he reached for his coffee cup. He blamed it all on poor sleep and didn't want to bother anyone. On the 3rd day, he had a mini stroke. Looking back, he said, "I didn't feel sick, I just felt off." That feeling was the first real sign. Another woman told me she thought she was simply tired from housework. She had spent the morning folding laundry, and by afternoon, she felt as if her whole body were wrapped in lead. Her thoughts slowed down. She couldn't recall the words she wanted. She thought it was aging, but it wasn't. Her brain was struggling with decreased blood flow long before the bigger stroke arrived. her body whispered before it screamed. These stories are far more common than most people realize. Fatigue is familiar, fatigue is expected, and that's exactly why stroke symptoms can hide beneath it. The brain does not always produce the classic signs right away. Before facial drooping, before slurred speech, before arm weakness, there is often a period of subtle neurological fatigue. A fog, a heaviness, a moment where something feels different, even if you can't explain why. Fatigue caused by neurological distress tends to feel different. It does not improve with rest. It may come and go in strange waves. It may appear suddenly after a small activity, like walking to the mailbox or chopping vegetables. It may be paired with slight vision changes or a pressure-like sensation in your head or a sudden inability to stay alert. When circulation changes, the brain reacts instantly, and that reaction often shows itself as exhaustion. This is why seniors are especially vulnerable. As we age, the brain becomes more sensitive to changes in blood flow, oxygen, and pressure. Neural pathways slow. Small issues with the heart or blood vessels show up earlier. What younger adults dismiss as stress or poor sleep, older adults experience more intensely. That heightened sensitivity makes fatigue one of the clearest early signs, if you know how to interpret it. When fatigue is neurological, it is not simply a feeling, it is an alarm bell. It is the body's way of saying something is interrupting the brain's power supply. And the sooner we recognize these moments, the more we can protect independence, mobility, and life. Hidden stroke symptoms that look like everyday tiredness. So many seniors I meet tell me the same thing. I just felt tired, nothing more. And that is exactly why stroke symptoms go unnoticed. Fatigue is familiar, it feels harmless, and it doesn't alarm anyone the way chest pain or slurred speech does. But when fatigue blends with subtle neurological signs, it becomes one of the most important clues your brain can offer. Let's talk about what these hidden symptoms really look like in everyday life, the ones that quietly sneak in and disguise themselves as nothing more than exhaustion. One of the first is sudden heaviness in the arms or legs. It doesn't have to be dramatic. Maybe you're lifting a pan from the stove and your arm feels heavier than usual. Maybe you take a few steps and your leg feels sluggish or unsteady. Most people chalk it up to fatigue or a long day, but heaviness is the brain's way of saying something is interfering with muscle communication. Another symptom is an unusual pressure in the face or head. Not exactly a headache, not exactly pain, but a strange weight that makes you pause for a moment. I remember a patient who described it as, like my face forgot how to sit on my bones. She thought she was just tired from errands. In reality, her brain was experiencing reduced blood flow. Vision changes are another powerful sign hidden under the mask of exhaustion. Many seniors assume blurred vision is simply eye strain or a need for new glasses. But when vision blurs suddenly, lasts a few seconds, and then clears, that can be a sign that the part of the brain responsible for processing vision isn't getting the oxygen it needs. These moments often occur 24 to 72 hours before a stroke, which means they are precious warnings, not inconveniences. Then there is the quiet kind of brain fog that makes you feel disconnected. You may sit at the table and suddenly lose your train of thought. You may zone out mid-conversation. You may forget what you were about to do even though it was obvious a moment ago. Aging can cause some forgetfulness, yes, but when this fog appears suddenly, especially alongside fatigue, it can be neurological distress. A symptom many seniors ignore is excessive yawning or an inability to stay alert. People blame it on a poor night's sleep, but yawning is a reflex tied to oxygen and brain temperature regulation. When the brain is struggling, yawning can increase as a way to bring in more oxygen. If you find yourself yawning unusually often or feeling like you can't stay awake without reason, your brain may be signaling that something is wrong. Another symptom often misread as tiredness is a sudden weakness or trembling in the hand while performing simple tasks. Something as ordinary as lifting a cup of tea or buttoning a shirt might reveal a small tremor. Many older adults laugh it off or say they're just getting old. but small, sudden hand weakness can be one of the earliest signs of a transient ischemic attack. Word-finding difficulties are also common. You might be speaking and suddenly struggle to find a simple word. People dismiss it as fatigue or distraction. But when language hiccups come without stress or tiredness leading up to them, it's often because the language center of the brain is misfiring. One woman told me she couldn't get the word spoon out while setting her table. She said it felt as if the word was trapped somewhere far away. She thought she was tired. It turned out to be one of her first signs of a mini-stroke. Subtle facial drooping is another symptom many people do not notice. It doesn't always look dramatic. Sometimes it's as small as one corner of the mouth feeling heavier or food slipping from the lips slightly more often during meals. Seniors usually blame this on fatigue or dry mouth, but it can be the first sign that the facial nerves are being affected by reduced blood flow. These symptoms are dangerous precisely because they mimic everyday tiredness. They blend in, they hide, they feel harmless, and most importantly, they pass quickly, making people believe nothing serious is happening. But these small events are often the brain's early warnings before a larger stroke arrives. Recognizing these moments can be life-changing. I've seen patients who caught their symptoms early and avoided severe damage. And I've seen others who ignored them because they felt like nothing more than fatigue. If you pay attention to the difference between normal tiredness and neurological tiredness, you give yourself the power to act early, to call for help, and to protect your independence and future. Why seniors are more vulnerable. One of the hardest truths I've learned in my decades of caring for older adults is this: the aging brain becomes more vulnerable long before most people realize it. Stroke symptoms hiding behind fatigue affect seniors more often because their bodies handle stress, blood flow, and oxygen very differently than they did at 40 or 50. And many people underestimate how these changes quietly set the stage for neurological strain. As we age, our blood vessels naturally become stiffer. They don't expand and contract with the same ease. This makes the brain more sensitive to fluctuations in blood pressure. Even small spikes or dips can briefly disrupt the delivery of oxygen. When that happens, seniors feel it not as pain or dizziness, but as sudden exhaustion. It is the brain's way of saying, "I'm struggling a little. Slow down and pay attention." Circulation also slows gradually over the years. The heart works harder to push blood upward toward the brain. When the circulation falters, even for a moment, the brain responds with tiredness because it is not getting the consistent flow it needs. That kind of fatigue feels different from normal tiredness. It arrives unexpectedly. It makes limbs feel heavier. It creates moments where thinking feels blurry or slow. Another major factor is heart rhythm. Conditions like atrial fibrillation, even when silent, can cause brief periods of reduced blood flow to the brain. These episodes are often so subtle that seniors do not feel palpitations or chest discomfort. Instead, they feel worn out. They feel as though the day suddenly got heavier. Many do not realize this is neurological, not emotional or physical fatigue. Blood thickening is especially common in seniors who do not drink enough water. Dehydration is one of the hidden contributors to stroke risk. When the blood thickens, circulation slows further, making it even harder for the brain to get what it needs. I cannot count how many seniors have told me, "I didn't think I needed much water," when in reality, dehydration was intensifying their fatigue and masking early stroke signs. Diabetes also plays a role because it damages the nerves involved in both sensation and alertness. Many older adults with diabetes experience fatigue frequently, making it even harder for them to distinguish between normal tiredness and neurological symptoms. And sleep problems, which become more common with age, add another layer of difficulty. Poor sleep disrupts the brain's ability to recover, and chronic tiredness becomes the background noise of daily life. All of these factors make seniors more likely to dismiss unusual fatigue. I once cared for a man who felt exhausted every afternoon for a week. He told his daughter it was just age. But his fatigue had a pattern. It happened after lunch, when blood pressure often shifts and digestion taxes the heart. Eventually, he experienced a TIA. Looking back, He realized those afternoon episodes were his early warnings. Another patient told me she felt drained after her morning walk, even though it was a routine she had followed for years. She brushed it off until her right hand began trembling slightly whenever she reached for her water bottle. That was her first neurological sign. The tiredness had been her body's first whisper. These stories remind us that seniors experience fatigue differently. Their bodies speak more softly. Their warning signs blend in with everyday life. And that is exactly why understanding the difference between normal tiredness and neurological fatigue is essential. The difference between normal fatigue and dangerous fatigue. One of the most important questions I help seniors understand is this: how do I know if I'm just tired, or if my brain is trying to warn me? It's a powerful question because recognizing the difference can change the outcome of your health, your independence, and your future. Normal fatigue is something your body can explain. You take a long walk, you have a busy day with errands, you garden a little too long, or you sleep poorly. That kind of tiredness has a clear reason. It builds gradually, not suddenly. And most importantly, normal fatigue improves with rest. You take a nap, you sit for a while, you drink some water, and your energy slowly returns. Neurological fatigue is different. It arrives without a clear cause, often out of nowhere. You could be doing something simple, like preparing lunch, folding clothes, or reading the newspaper, when suddenly your body feels heavier, slower, and unfamiliar. It may feel as if something inside you dimmed the lights. And no matter how much you rest, that strange exhaustion doesn't fully go away. Dangerous fatigue often comes with other subtle shifts. Balance may feel slightly off. Your foot may drag for just a second. Your hand may tremble or feel weak when holding a fork or cup. You may struggle to find a word or feel confused for a moment, as if your thoughts are moving through mud. You might feel pressure inside your head, not pain, but a sense of something tightening or pressing. Normal fatigue does not cause facial asymmetry. Neurological fatigue sometimes does. It can cause one side of your face to feel heavier or a slight droop that comes and goes. Normal tiredness does not create sudden vision changes, but stroke-related fatigue often brings brief blurriness or flashes of double vision. Normal fatigue does not affect your speech, but dangerous fatigue can make words feel harder to shape or say. One woman told me her fatigue felt different, like my body didn't belong to me. She wasn't dizzy, and she wasn't in pain. She was simply drained in a way that didn't match her day. She dismissed it as age, but it was her first neurological warning. 48 hours later, she had a mini stroke. The biggest mistake seniors make is assuming all fatigue is harmless. When fatigue behaves strangely, appears suddenly, or comes with other small symptoms, it deserves attention. Dangerous fatigue is your brain's early alarm system, long before the classic symptoms of stroke show up. Listening to that alarm can protect your speech, your mobility, and your independence. Stress, weather, and lifestyle triggers. One of the most surprising things I've learned over the years is how deeply the environment and daily habits influence the brain's energy. Many seniors assume fatigue comes only from lack of sleep or physical exertion, but stroke-related tiredness can be triggered by far more subtle factors. These triggers often intensify neurological fatigue and make the brain more vulnerable, especially in older adults. Weather is one of the most underestimated contributors. Extreme heat can cause dehydration, which thickens the blood and reduces oxygen flow to the brain. When this happens, seniors often feel unusually tired, not realizing their brain is being strained. In the winter, cold temperatures stiffen blood vessels and raise blood pressure. That combination can produce sudden fatigue or a foggy feeling that is often mistaken for simple tiredness. I remember a patient who felt drained every afternoon during a cold snap. She blamed the weather for making her sleepy, but her body was struggling with sharp blood pressure swings. 2 days later, she experienced a transient ischemic attack. Sleep also plays a bigger role than most people realize. Poor or interrupted sleep reduces the brain's ability to regulate blood pressure and circulation the next day. Many seniors already struggle with insomnia or shallow sleep. When the brain is tired, it becomes more sensitive to any small disruption in blood flow, making stroke-related fatigue more likely. One of my patients described it perfectly. It felt like my brain didn't recharge overnight. High-sodium meals are another trigger that often goes unnoticed. A salty dinner can cause temporary spikes in blood pressure, especially in older adults. When the brain suddenly receives blood flow that is too forceful or inconsistent, it reacts with fatigue, heaviness, and sometimes vision changes. Many seniors chalk this up to feeling sluggish after eating, but it can be an early warning sign that the vascular system is under strain. Stress is another powerful contributor. Emotional stress tightens blood vessels and increases adrenaline, making the heart work harder. Seniors often tell me they feel exhausted on stressful days, even if they didn't do much physically. That exhaustion is not emotional alone. Stress alters circulation, affects breathing patterns, and can reduce the brain's oxygen supply for brief periods. When a patient once told me, "I felt drained after the phone argument with my son," I knew her fatigue was more than emotional. She had a mini stroke 48 hours later. Even overexertion in small ways can become a trigger. Activities like lifting groceries, sweeping floors, or climbing steps may seem harmless, but for seniors with circulation issues, these small exertions can trigger neurological fatigue when the brain does not receive adequate blood flow fast enough. Each of these triggers makes the brain more vulnerable, and because the resulting symptoms mimic everyday tiredness, most seniors ignore them completely. But these are the moments the brain whispers its warnings. These are the moments that deserve attention. There's something I've learned after decades of caring for older adults. Understanding your health is one of the greatest gifts you can give yourself. And if you're still here with me, still listening, it tells me you care deeply about protecting your mind, your independence, and your future. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you, your loved ones, and the millions of seniors who deserve clear, compassionate guidance. Your support truly matters. It allows us to reach more people who might be ignoring the very symptoms we're talking about today. And together, we can save lives simply by spreading awareness. How to protect yourself from fatigue-related stroke symptoms. Now that we've explored how stroke symptoms can hide behind what feels like ordinary tiredness, let's talk about something even more important: what you can do to protect yourself. Knowledge is powerful, but action is life-saving, and I want you to feel confident, calm, and prepared each time your body sends you a subtle message. One of the most essential steps is learning to observe patterns of unusual fatigue. I'm not talking about the tiredness that comes after housework or a long day. I mean the kind of fatigue that feels out of place, the kind that makes you pause and think, "This isn't my normal." When you notice that sensation, especially if it comes with heaviness in your limbs, brain fog, or brief vision changes, take it seriously. Write it down. Share it with someone you trust. These patterns speak loudly when we pay attention. Monitoring your blood pressure is another powerful tool. Many seniors only check their blood pressure during medical visits, but the brain needs you to be more attentive. Stroke-related fatigue often appears when blood pressure fluctuates suddenly or climbs too high. If you feel an unusual wave of exhaustion, check your blood pressure within that moment. If the numbers look different from your normal range, that information can help you and your doctor make safer decisions. I've seen patients avoid major strokes simply because they recognized abnormal readings early. Hydration plays a far bigger role than most people realize. Dehydration thickens the blood, forcing the heart to work harder and making it more difficult for the brain to receive oxygen. Seniors often drink less water because they don't feel as thirsty or want to avoid extra bathroom trips. But your brain needs hydration to stay healthy. Even small amounts of dehydration can contribute to neurological fatigue. Keep water nearby throughout the day. Sip often. Your brain will thank you. Salt intake is another factor worth mentioning. High-sodium meals, even ones that seem harmless, can spike blood pressure rapidly. This can create a sudden drop in brain efficiency, leading to the type of tiredness that isn't just tiredness. Reducing salt even slightly can make a noticeable difference in how stable your energy and focus feel. A patient once told me, after cutting back on sodium, I didn't realize how much clearer my mind could feel. That clarity matters. Gentle movement is another lifesaver. I'm not talking about intense workouts or long walks, but small, intentional movements that promote circulation. Stretching your legs, rolling your shoulders, taking a short stroll, or moving your ankles while sitting in your chair. These small actions encourage blood flow to the brain and help prevent the sluggish circulation that contributes to neurological fatigue. I often tell my patients, movement is medicine, especially when it's gentle. Recognizing early neurological red flags is a skill that every senior should have. If you feel fatigue paired with imbalance, facial heaviness, vision shifts, or trouble finding words, stop what you are doing. Sit down. Pay attention. These moments are not inconveniences. They are warnings. And when you catch them early, you give yourself the gift of time. Caregivers play a huge role in prevention as well. When you notice a loved one looking unusually tired, zoning out, or moving slower than usual, don't assume it's just aging. Ask them how they feel. Look at their face. Notice if one side seems different. Offer them water. Encourage rest and conversation. Sometimes a caregiver's awareness makes the difference between early care and a dangerous delay. It's also helpful to build morning and evening self-checks into your daily routine. In the morning, take a moment to assess how you feel when you first stand or walk. Does your body feel balanced? Is your vision clear? Do you feel rested or strangely drained? In the evening, notice whether your fatigue matches your day. Unusual exhaustion at night, especially paired with pressure in the head or confusion, deserves attention. Finally, know exactly when to call 911. If any sudden weakness, facial drooping, slurred speech, or severe confusion appears, even if fatigue has been the only sign before that moment, do not wait. A stroke can move quickly, and every minute matters. Calling for help is not overreacting. It is protecting your life, your independence, and your future. The most important message I can give you is this: your body is wise. It speaks softly long before it shouts. And when you learn to understand the difference between normal tiredness and neurological fatigue, you give yourself the chance to act early, stay safe, and preserve the life you love. As we come to the end of our time together today, I want to return to a truth that lies at the heart of everything we've talked about. Your brain holds every memory you treasure, every moment that shaped you, every face you love. It is the keeper of your stories, your laughter, your wisdom, and the life you've lived. And sometimes, when the brain is struggling, it doesn't shout. It whispers. Fatigue may seem ordinary, but there are moments when it is the body's quiet cry for help. Understanding those whispers is one of the most powerful things you can do for yourself. Early awareness protects far more than health. It protects your independence, your mobility, your speech, and your dignity. When you pay attention to the unusual ways your body feels, you are giving yourself the chance to act early and stay safe. Listening to your body is not fear. It is strength. It is wisdom. It is honoring the life you've built. I'll never forget a patient who sat across from me with tears in her eyes and said, "If I had known fatigue could mean a stroke, everything might have been different." Her words still stay with me. They remind me why conversations like this matter, and why your awareness can change the outcome of your story long before danger arrives. Thank you for spending this time caring for yourself, for choosing to learn, and for valuing your health. It's an act of love, both for you and for the people who care about you. Be gentle with your body, stay observant, and trust your intuition. You know yourself better than anyone. Stay safe, stay aware, and remember that your health is worth protecting every single day.